You know, there are some people who at such times as these might turn their heads skyward and ask, like the prophet Job, "Dear Lord, why have you turned your wrath upon us? What have we done to deserve this terrible destruction?" But I believe not in a wrathful God, but a merciful and compassionate one. I look across this room and see hundreds of men and women who are blessed with the skill and knowledge to heal the sick, mend the injured, and bring comfort to the afflicted. I look across this great state and nation and see thousands who have risked their own lives and possessions to help strangers and who are in even worse circumstances. As Harvey flooded Houston, we all read and heard of the physicians and nurses and techs, janitors, custodians, cafeteria workers who worked days on end caring for patients who had nowhere else to go, unable to be relieved by their colleagues, or who were flooded out of their hospitals. Why? Those are the questions we have for our two panelists this morning. David Tischer is an orthopedic surgeon formerly of Beaumont, was recently appointed by the White House as Regional Director for the U.S. Department of Health and Human Services. Dr. Tischer facilitates communication regarding HHS initiatives as they relate to state, local, and tribal governments. Region 6 includes Texas, Arkansas, Louisiana, New Mexico, and Oklahoma, and 68 federally recognized Native American tribes. Dr. Tischer has served as president of the American Academy of Orthopedic Surgeons and the Texas Orthopedic Association, and is a former member of the TMA Board of Trustees. After earning his bachelor's degree from the University of Illinois at Urbana-Champaign and medical degree from the University of Texas Medical School in San Antonio, Dr. Tischer completed an internship and residency at the Brooke Army Medical Center at Fort Sam Houston. David served in U.S. Army Operations Desert Shield and Desert Storm and completed 13 years of military service as the Chief of Surgery at Fort Sill in Oklahoma. He entered private practice in 1993, retiring in 2016 as past president of the Beaumont Bone and Joint Institute, where he specialized in orthopedic sports medicine. Our other panelist is Mr. Kirk Cole. Kirk is Senior Advisor to the Commissioner of the Department of State Health Services and the Interim Assistant Deputy Commissioner. He served as the Associate Commissioner of DSHS October 2011 to January 2016 and as Interim Commissioner of the agency from February 2015 to January 2016. Mr. Cole has been with the agency for 12 years in various leadership posts, primarily focused on consumer and governmental relations and public health policy. As Associate Commissioner, he was second in command and played a key role in advising the Commissioner and state leadership on public health and agency management issues. He works to make sure that agency programs are responsive to the needs of the people of Texas and in line with the goals and priorities of the state. Before coming to DSHS in 2004, Mr. Cole worked for the Texas Commission on Alcohol and Drug Abuse in Communications and Government Relations, and for the Texas A&M University as an assistant administrator for student health services. Kirk received a bachelor's degree in health and a master's degree in urban planning from Texas A&M University. Gentlemen, please spend a few minutes giving us an overview of what you've been up to these past few weeks. Then we'll move on to some questions. Let's start with Dr. Tischer. David?
If you've been through one hurricane, you've been through one hurricane. This is my fifth to actually experience. They're all very, very different, and it depends on your role. That is very, very unique. It's been a unique perspective to be over on the federale side. So I have become the enemy that I always hated. I'm the federal. And so I remember what Ronald Reagan said, the worst things a taxpayer can hear is, "Hi, I'm from the federal government, I'm here to help you." So I am here to help you, and hopefully after this talk you'll understand how we are going to try to help Texas heal this massive wound that's 300 miles long and 100 miles inland. So the zone of injury is very extensive. I'm very pleased that Kirk could join us today. I've gotten the opportunity to get to know him, and I will say this to you, and you know this, is that it's all about the relationships. And so when you have a good relationship with your federal and your state and your local partners, then good things are going to happen. There's some things that only government can do, and there's a lot of things that the government can never do. And so most of this response, at least in the rescue phase, was very local. There were people getting on their airboat or in their flat bottom boat and going and rescuing literally 100 people. The story that I like to tell is one that I didn't get to see on the TV news, but it was 2 young fellows pulling people out of the water on a Saturday when the storm was raging in the Golden Triangle. And a TV news crew came up and said, "Hey, come over here, we want to interview you. Where are you fellows from?" "Well, we're from Louisiana." "Well, how old are you?" "You look awful young." "Well, we're 18. And the news reporter said, "Aren't you awful young and awful far from home to be out here in harm's way?" And the one fella in a Forrest Gump moment says, "How old you gotta be to save somebody's life?" How old you gotta be to save somebody's life? And that was, I think, the quote of the storm. Kirk?
Okay. Thanks, Dr. Tischer. So this is Harvey. Some of us saw this storm a lot closer than others, and some of you may, here in the room, may have been in the thick of things as it struck on August 25th near Rockport. Category 4 storm, 130 mile an hour winds. And I'm going to jump to the next slide because I think it really illustrates the challenge of this particular storm. Major hurricanes happen regularly. We track them as they come across the Atlantic Ocean. The issue with this one, starting back in August 13th, made its way across, never really way too strong, got to the Yucatan Peninsula, it dissipated, it went away. And usually that would be around the time we start planning. We normally start planning for a hurricane about 5 days out. And there's a system that's already set up, lots of experience through hurricanes, Katrina, Rita, Hurricane Ike, to have that planning horizon and all the things that need to be done. The challenge with this particular storm is that it reforms on the other side of the Yucatan Peninsula. Doesn't appear that it's going to be bad, and then within 2 days it's a Category 4. So lots of challenges there in terms of planning, and we had to move quickly to put things in place, to plan for evacuations, to plan for shelters and those kind of things. The issue is, and as Dr. Tischer talked about, those partnerships, the relationships and the plans have to already have been in place, and those are there. And so if you have to do them on a faster pace, you do them on a faster pace, and that's exactly what we did. We've already established lots of contracts for different kinds of things that may be needed for emergency medical assets to get down to the area to stage and then to get people out of harm's way. Medical shelters for those patients that are maybe don't need to be in a hospital but need special medical care. Oxygen is a big issue in terms of being able to supply ambulances, those kind of things. Pharmacy. People are now away from home. How do they get their medications? We had contracts with HEB, CVS, Walgreens, Brookshire Brothers, and others to be able to help fill prescriptions for people who are away from their homes. In disaster planning, it's got to be really flexible also, though. So the changing storm track, you're constantly watching a storm that doesn't appear that it's going to be much other than a tropical storm that then spun up really fast. So sometimes you've got to modify how you're going to react, but you have to have those base plans in place. And who would have predicted? So when you look at this particular slide, the longest part of the red line isn't really consequential. It's from when it reforms and then it stalls over Texas. So we not only had a hurricane that usually moves on through the state within 1 or 2 days to one that sat over our state for 5 days and dumped 50 inches of water in some places, maybe more. So created a lot of challenge. You usually have one impact zone and you're done. It's just the path of it through the state. This one covers almost the whole Gulf Coast. And so as we talk about our response and as we look at a few slides, a slide and a few minutes later, you'll see the scope of the kind of response we normally do, but we did it basically 3 or 4 times across the Gulf Coast as we looked at where the impact of Harvey would be. Just to quickly set the stage for how we do our response, Texas is a home rule state, so local governments, are in charge of running a disaster and responding to a disaster until it gets beyond their capacity and they say we need help. The state has to plan and have things in place to be able to assist those local communities when they respond. They can raise that up and it can get handled regionally at what's called a disaster district, which is a state entity, but it works there at the local level, or it gets elevated to the State Operations Center. For Texas Department of State Health Services, we are in charge of the State Medical Operations Center, and that's the health and medical response for the state. And so we help to fill those resources with things that we've hopefully anticipated correctly need to be in place and need to get pushed out whenever locals need that. When capacity for the state is beyond our resource, we reach out to the federal government. We already have those long-standing relationships, and the federal government, just like we've done for the locals, they've done for us, planning about what may be needed and leaning forward and having some of those assets closer to the state so that they can jump in when needed. And so it really does work as a system, and it's built with planning already in place and with the anticipation that there's going to be a need for help at certain times. And so it works really well together, and we really appreciate all that our federal partners have done to provide either assets or information or advice on responding.
So if you look at this, this is really a great graphic, because as that thing came across the Yucatan, it was nothing. It was weak. And as Kirk was talking about, there's a state operations center in North Austin in the basement. It's literally a bunker in DPS headquarters. If you've ever been there, you'll see it's incredibly well organized. I think we've got a slide from it later on. Kirk also talked about what's called the SMOC. So that's the SOC. The SMOC is the State Medical Operations Center, and that's in the...
It's in our lab building.
The lab building,
Department of Health Services.
right near like 4900 Lamar as you go back to the back side. So there's a SOC and a SMOC, and then there's a CMOC, okay? And now we've got a JFO. So we're operating out of the Joint Field Office. So just so you understand where we're at from the Secretary of Health and Human Services, Dr. Tom Price, and this is only the fourth secretary that we've had that was a physician, and I can't think of a better time to have one of our own members, an AMA member and a fellow physician and a good friend of mine and a good friend of Texas, Dr. Tom Price, as the lead, because that thing came over the Yucatan. He has his own SOC right across the hallway from his office. It's called the Secretary's Operations Center. And it looks like NASA headquarters, you know, NASA operations. It's a four-sided area. There's all this bank of all these things. They got NOAA. They've got the Weather Service. They can bring in everybody. They can video conference. I mean, it's just banks and banks. And the chairs always change. So you may come to work today and you're not assigned to be in the SOC. So as soon as that thing came over the Yucatan, all of a sudden the fur starts flying because it elevates to a Category 1, and you'll recall it went from a 1 to a 3 in less than 6 hours. So this thing really ramped up fast, which hindered our ability to lean forward and push hard. That's our motto in our Assistant Secretary of Preparedness and Response. So if you think about HHS as just being CMS, you're wrong. It's 27 different operative divisions. It's a giant octopus with 27 different tentacles. And if you like acronyms, you'll love HHS at the federal level. It's taken me a long time to be able to determine what exactly our agency, ASPR is what it's called, actually pushes forward with all kinds of assets. So they were actually deployed on the Wednesday before landfall into Austin with an operations center sitting right next to our state colleagues saying, what are you seeing? What are you hearing? This is what we're seeing. This is what we're hearing. And we deployed over a dozen DMATs. That's the Disaster Medical Assistant Teams from all over the country. All parts of the country were tasked to bring their DMATs in, mostly into Dallas because we didn't know where the storm was going. We know it was getting big, it was getting bad, and it was really accelerating us. But we were actually pre-positioned with an incredible amount of assets. But as Kirk says, we can't, as federals, go anywhere without the state asking for assistance, and the state can't go anywhere without the county judges asking for assistance. So the county judges are kings. Home rule, that's the way we have our state government set up. Some of our county judges have said, we don't need assistance. Okay, fine. That gives us an opportunity to deploy assets elsewhere where assistance is needed. But this thing ramped up extremely fast and made landfall. And you recall the initial reports, it was going to back out and come back and punch that coastal bend again. Instead, it looked like a bowling ball just raking down the whole coast. So I've got a ranch out here in Bastrop County. We took 21 inches all the way up in Bastrop County. I know folks in Beaumont recorded 48 inches. We set the all-time record for rainfall with 51.5 in Harris County. When do you have a 4-foot wall of water land on you like that? And I've explained to people, you know, how do you look at the geography of Texas? Well, if you take your right hand and put your palm on the Gulf of Mexico and your right thumb is the Rio Grande, you're missing 3 other fingers that are the 7 big rivers and tributaries. And that's what happened. They all filled up and got out of their banks. So this was really a flood event. It wasn't so much a wind event unless you were in Rockport in that coastal bend, but it was a flood event. And it just went on and on and on. So it was very unusual. But we had our assets pre-deployed, ready to go. We had people in the field, and we're sitting right next to the SMOC and SOC colleagues in Austin, ready to go as soon as the state says our resources are exhausted and the local resources are exhausted. But you'll recall that first 48 hours to 72 hours, it's all a local response. The locals got to save themselves, and they did great.
How is the state managing physician volunteers now? I'll pose that to both of you.
So for volunteers, there is a website for physicians to volunteer up front. Right now, because this was mainly a flooding event, things developed more slowly. Some of the systems in place, the hospitals, a lot went down but came right back up, and so there wasn't a lot of extra need in medical shelters. We didn't have big populations in our medical shelters because hospitals largely did not close down, and so there ended up being less need in this particular event than maybe we've seen with some others in the past, particularly Katrina. And there's been a lot of comparisons. People are trying to compare in terms of recovery. 2 very different things. Their whole health system went down. Our hospitals largely stayed up, and I know at the local level there's impacts on individual offices and those kind of things, but our bigger institutions stayed up. But there is, and I saw this on your website a second ago when I was looking at the link that was on the board up there, and there's a link to our site. It's texasdisastervolunteerregistry.org, and it's all one big word. But if you go there, physicians, other health professionals can volunteer, and that makes that information available to people at the local level too. We've struggled in the past on trying to take in volunteers and place them in different places locally, travel, figuring out all the logistics. We don't need to be in the middle. That makes it more confusing. And so what we really try to do is get that information before the event, connect people up locally. I think there's lots of opportunities locally today in communities, and just plugging in with local nonprofits and those kind of things is a great way for physicians to plug into those things.
So there's a complex answer to that question. The first thing is that you're a very experienced human being, and you can do anything that any other human being can do. You may not be using your specialty skills in order to volunteer. There's this thing called mucking. It's called pulling all of the sheetrock and all of the perishable products out of a house so it's down to nothing but sticks and bricks. You save houses. The cost to rebuild is about 1/3 of what it would be to rebuild the whole house. And right now we're in a race in many areas that are flooded to be able to get all of the sheetrock, which is not drywall, it's wet wall now, all of the flooring, and all of the other materials, including carpeting, out of there so it can dry out. Once it dries out, then we can get in there and figure out what is it going to take to rebuild this house, but the superstructure is maintained so it doesn't have to be replaced. So if you want to volunteer, there's a lot of opportunities. I know of my old church, my former church in Beaumont, has organized 28 churches, and they're out there mucking everybody in the community. And they have homes and rooms. If you want to go to Beaumont, I can put you in touch with people. You can go volunteer. You'll need some eye protection. You'll need some facial protection so you're not breathing that stuff in. You'll need some gloves. You'll need some boots. And you'll need some equipment, a wheelbarrow, a crowbar, and some hammers. And you're going to work. You're going to work like a dog, but you're going to make a difference. So there's a lot of opportunity for you to volunteer there. The time to volunteer to do what you do in medicine is before the storm. So let me give you a couple of good ideas if you decide this is the sentinel moment for I want to volunteer. I want to be in on the next disaster. For instance, Harris County, Dallas County, and I'm sure other counties organized their county medical societies and staff the mega centers. They staff the mega centers with volunteers. So the basic building blocks are our county medical society. So organize around your county medical society. And if you have a mega center or even shelters that are smaller, a lot of the shelters were in churches and other smaller areas. They've now consolidated into the mega centers. The second is if you really want to volunteer to be on a DMAT. Now that's signing up and saying, I'm going to go anywhere in America that they need me. And it may be Spokane, Washington. It may be Virginia. And you'll go with a team. You're going to have a background check. You're going to have to be pre-credentialed. It's a process. But those DMAT teams are part of ASPR, which is part of HHS, and they're the basic building blocks that we use to reestablish medical services in areas that have literally been knocked out. Second is the Medical Reserve Corps. Medical Reserve Corps is you're registered with the Medical Reserve Corps, you're available and can be called up. So if you really don't want to be on a leash and tethered to a DMAT, but you want to be on, I can volunteer if they call me, sign up with the Medical Reserve Corps. Another area, and this is something that was very instrumental, the governor called out the entire National Guard. National Guard has medical assets. If you want to volunteer, be a member of the Texas State National Guard. And then the last is sign up for a non-governmental organization, NGO. Most of those will require some type of credentialing and a background check and some training, but they go and perform humanitarian missions. One of those that's especially effective in this is the Texas Baptist Men. And they brought in the Baptist men from 5 other states, and they've populated a lot of that forward-leaning area. They're out there on the front line getting people out of those flooded areas, saving lives, and then rebuilding that housing stock so we can reconstruct it as we move from the whole rescue into recovery. And that's really where we're pivoting right now. And I'll let Kirk talk a little bit more about where we're going with recovery, because recovery is not going to be in the next month. We're talking about years. Kirk?
Okay. So the next 2 slides, I think we've kind of touched on some things here, so I'll just run through those real quick. Health and medical, real big response up front in terms of getting a lot of things in place, and then on the back end, there's a whole lot of things then on that recovery front as well. But as the storm moved, as we showed on the track a minute ago, we started with a very small group of, 25 ambulances and a few of our ambuses, which are basically buses that carry about 20 patients, and then some staffing for those, but also to help stage and organize those. We ended up with over 200 ambulances, working with our federal partners to bring some of those in, as well as various aircraft, whether rotary or fixed wing. Lots of different things you see there. Some of those are things, but they're all people who have to work in those areas to really be able to go in, bring people out of harm's way. And some of those are going into a hospital, a mission that goes into a hospital to evacuate patients. In a lot of cases, they may go to a spot where they're pulling people out of flooded houses, and they're bringing them to a spot, and they're putting them in an ambulance there, and then they're getting them out. And then we'll show a map in a minute that really shows the scope of how some of this works.
Look at the top right, mortuary trailers. You don't think about that unless you've been deployed downrange in a combat operation, but that's really important. We have refrigerated trailers that we deploy. Thank God we didn't need a lot of them. Thank God, because I can tell you that the local coroners are not able to take the surge capacity early on. So those refrigerated trailers can preserve corpses in a state that then we can deal with a few days or a week later to get them out of that zone of injury. So if you think about this is a really huge operation, a lot of moving parts. And so I know Kirk and I have been on separate but equal multiple conference calls every day. The SOC changes shift at 6 a.m. Central Time in DC. They have a brief out and a brief in, and they change again at 6 p.m. So I've been on those calls. In fact, driving in this morning, I was on a 6 a.m. call, listened to the brief in and the brief out, and they briefed in on what was going on with Harvey's bad little sister, Irma, and then they briefed out on what they were doing with Harvey. And I can tell you the secretary, every time when he gets his briefings, which come immediately after the brief in, brief out on shift change, he will always say, okay, enough on Florida and Irma. What are we doing for the good people in Texas? Every time he brings up, what are we doing for Texas? What are we doing for Harvey? Are we pushing hard? Are we leaning forward? Are we asking our state partners to let us help? What other assets do you need? And I will tell you this, is that your staff at TMA was incredible. I got calls all the time. We got this problem. We got that problem. And you know what? Orthopedic surgeons carry hammers. We use them. But I'm only carrying one right now, and it's a 16-pound sledgehammer. And that's all I know what to do is I start pressing buttons. The TMA calls, you call me, there's a need out there, and I start pressing buttons. So, as you know, our executive commissioner of HHS, Mr. Smith, called me on Saturday at 5:30 in the morning. Yeah, my phones blow up at 5:30 in the morning now, and I carry two of them. One's a federal phone, and one's my own. But that's okay, call me. And he was not very happy because he was told, even though the storm was raging, it was going to be a major disaster, that he couldn't get any 1115 or 1135 waivers looked at by CMS until next week, when they all came in to work in dry conditions in DC. And he thought that was unacceptable. I agreed with him. And so I said to him, I said, okay, can you explain to me? And he said, I just sent you the email, read it. I said, I'm on it. And by noon, we had all those 1115s and all those 1135s signed off by Secretary Price. That's TMA in action. That's knowing how to have that relationship so that we can get help on the way. And it's the power of being ready. I can tell you this, is that Texas physicians at TMA are world famous right now. They don't want to hear any more in the Secretary's Operations Center about the TMA, because that's all I talk about is the TMA's doing this, TMA's doing that, TMA's identified this problem. How can you help? And the Secretary's basically told them, look, if Tischer calls, you just fix it. Okay, be helpful. That's really important. That's really, really important that we have the reputation. And as I told the Board of Trustees, I had a little impromptu meeting with them yesterday. We were resilient. We weathered the storm. We survived. We helped our neighbors. We got them out of harm's way and out of the water. And now we're resolute. We are going to take care of the 28 million Texans that the 52,000 of us that are privileged to have a license to practice and be TMA members are going to do. And then at the same time, and lastly, we're going to be relentless. This is going to take several years. We have to be relentless. We have to keep putting this storm on the front page because it's fallen off the front page. It's fallen off the TV news. We can't forget that there's a lot of reconstruction to do.
Let me ask both of you. These are a couple of questions that came from the Council on Public Health and Scientific Affairs. There seems to be a lack of inclusion of private practicing physicians in both the communication and status structure of the state's emergency response. How can this be rectified, and how can TMA help?
I think on our front, that's an area that we definitely identified and had noted of where we can do some improving on that. We were in communication also with TMA staff, really good about letting us know about things, and the governor's message was get the barriers out of the way. And so we really worked hard to try to do that as well through state government, through Department of State Health Services and our Health and Human Services. A lot of times, though, I think during the heat of battle and trying to get things done and respond, we don't always think about communicating out and the messages and the information that people may need, not just for evacuating and those kind of things, but for supporting what's going on. And so we worked closely with TMA staff during the event to provide some information that was needed. But I think we can do that more proactively. And so after every disaster, first thing you do after action, try to figure out what you can improve on. We haven't done one of these in a while, and so shaking a little bit of rust off early on. Things, though, were in place and worked well, but there are always places you can improve, and so we're going to focus on how do we partner better with associations and things like the TMA that are out there, so we can make sure that you all have the information you need to help in the communities.
Well, we have a 52,000 strong Army ready to deploy, and I think if we work on communication and work ahead of time to get people engaged, so they know because we've got lots of questions from a variety of practitioners all over the state about what can I do, how can I get involved, and I think all of that's really important. So we look forward to working with you as we look at the aftermath and we do the analysis about what we can do to improve things, and TMA stands ready to do whatever we need to do to improve it. God help us if it happens again anytime soon. Dr. Tischer, what is the federal government planning to do to waive penalties for physicians in all government payment systems whose practices were either destroyed or damaged by the hurricane?
Did Karen Batory write that question? Because I'll let her answer. What have we done? I mean, I've had a bulldozer out there, and we've been grading the road as hard as we can. We have had a number of federal waivers. Everything that we have given the Secretary, we have gotten. CMS Administrator Seema Verma is going to be in Houston on Monday. I will be accompanying her. I know that Commissioner Smith is going to have a meeting with her. I know I met with him yesterday for about 90 minutes. I was ready to let him go on his way after about 30, but he said, no, stay here. I got something else I want to talk about. So he is a guy that's fully engaged. So we're going to continue to make it as simple as possible. Let me give you a simple example. We had a situation where they were saying if you were mucked out of your office and you moved down the highway and were staying and officing with a colleague, that was a separate location. You're going to have to start a whole CMS process of asking for a brand new location, a very onerous and really sometimes, in my view, ridiculous process. So I thought about it in simple terms. Well, we had worked with the Dallas Postmaster and Congressman Pete Sessions on how do we solve the problem for everybody that's in the mega shelter in Dallas, but not getting their Social Security check in Houston. Well, that's simple. You just fill out a temporary change of address and you have your mail forwarded. So why can't we just have a temporary change of address for our physicians and have CMS say, okay, you're officed at this location permanently, but temporarily you're over here. Well, we pitched that idea, and within a day we had it done. So that's where we can work together. We need you to identify those problems. Getting back to the information, I would only say yes, fair criticism, but no, it's very difficult because when you're out there fighting the war, it's not the time to go out and print newspapers and send it back. And at the same time, and I'll give you a really good example, what you don't want to do is give bad information. So we've had this allegation of poisons in the water, E. coli, et cetera, et cetera. We're just getting our CDC and TCEQ teams out in the field to test it. So we don't even know. Kirk doesn't know. We were talking about this yesterday at the SMOC. I said, how bad is the contamination? Well, we don't know. We don't have reports. So the worst thing we can do is tell physicians things that turn out to not be true, because that erodes their confidence in the information that they get from us. So the most important thing for us is to give accurate information. It takes a while to gather that information. I'm not saying be patient, don't be patient, keep asking for it, but if we don't know, then there's no way that I think we can let everybody else know, and that's just the hazard of battle. Now, I will say we have broken up the federal response on emergency support functions, ESF, into 15 different lanes. And the state uses those same 15 as the federals. So it's very easy to have a federal-state partnership. When we go to the recovery support function, RSF, then we go into 6 different lanes, so that I'm not doing what this other agency is doing and they're not doing, and then there's no gaps. We're now working with the governor's office and others within state government to identify, okay, who is my go-to on this? I will tell you from my federal standpoint, what I am entrusted to do, I am the oversight of all things that are health and social services. So I have 5 main areas of focus. 1 is environmental health. That could be a really big issue. I hope it's not, but it could be a really big issue, especially if we don't muck these houses, and especially if we got contaminated water and we don't be careful. And we've got a lot of people in the water, a lot of exposure. It's like any other occupational health hazard. It could be a big problem, and it could be for years to come, and you can look at previous disasters, including 9/11. Behavioral health is going to be an emerging problem. Right now it's a problem. Usually they tell me about 3 months to 6 months out, it gets a lot worse. So we have behavioral health counselors from the federal and state level deployed out in the field already working that. And that's going to be a big problem. Infrastructure of healthcare. We're trying to get an assessment of what facilities are damaged and have to be replaced, what facilities are damaged and could be repaired, and then we're trying to get that list over to FEMA. FEMA is going to be the funding arm, not HHS. Workforce. We're looking at what about our healthcare workforce? Are they displaced? If you don't have a place to live and you don't have a place to work, how are you going to work there? And unfortunately for some of these communities, people that move away to shelter in Dallas and then decide to live with Aunt Alice in Oklahoma City and find a new job, they never come back. And the economic ramifications of that are long-lasting and permanent for the locals as well as the state. And then lastly, children. Not just K through 12, but childcare. Because I know when we experienced hurricanes in Beaumont, when the yellow buses started rolling and childcare opened up, normalcy started coming back to that community. So getting the children back in school, and even if they're in the shelter, the mega shelter in Dallas, giving them some type of educational activity that gives them a sense of normalcy. We're in a school year right now. Unfortunately, that's when hurricane season happens. And then lastly, higher ed. Making sure that our higher ed students who are already taking loans, already enrolled, and taking on that expense, that they can continue to get their education. The governor has asked higher educational institutions to adopt their local high schools and counsel those high school students locally to offer those counseling services so that the students don't have to traverse long areas. So again, we've got a great state and federal partnership, but that's my lane as HHS that I'm supposed to be running. Those are my 5 areas of focus, and that's what we're doing from that standpoint.
Great. Okay. What challenges for cleanup and resources do you think the state and the federal government, you've alluded to some of them already, can you think of any specific challenges for both cleanup and resources that may be needed on both the state and federal government? What are you facing now?
I think for now, the challenges, we have some immediate ones that are ongoing, just kind of health challenges, and then the bigger really is the recovery efforts as you start to look at what are the longer term kinds of issues. And so I think right now we're really looking at people taking precautions as they go back home, and being careful of the floodwaters and making sure they have their immunizations up to date. We've shipped about 50,000 vaccines down to the affected area, mainly tetanus. For people who are going back, aren't up to date on their vaccines. Those immediate kind of precautions. Dr. Tischer mentioned, wearing safety glasses, gloves, those kind of things that are gonna, most of the injuries are gonna be from recovery efforts, people going back into their houses, ripping things out and maybe not taking all those precautions they should take. They got a generator, they have it going in the house, just little things like that are some of those precautions you need to look out for. I'd also mention vector control. We've been pushing for 2 years now, do the things to avoid mosquito bites. We were focused on Zika. This is broader. Some of the efforts that are going on vector control are really about people being able to just even get outside and do the work, but we have a lot of vector-borne diseases, West Nile virus, Zika, others that we're at least concerned about, and so big vector control efforts that'll go on at least in the immediate future. And then I think for longer term, you're looking at things like water and other ground contamination, those kind of things that'll be a more of a partnership with us and the federal government and across state government to look at those things. And I was going to show you one thing on vector control. Before we go there, this was just some of the resources we showed you a second ago. And this is once it got over to Houston and Beaumont. When we started, we were in San Antonio. We have an operation there called the RMOC. So we have lots of great acronyms, but we have some regional advisory councils, trauma regional advisory councils that we contract with to stage ambulance and do those kind of things. But all that you saw on the previous slide that was a list, that shows it, but more of a geographic spread. Dr. Tischer talked about the State Operations Center. The orange signs you see on the ceiling are different functions that go on there, but you see military people, there are federal experts in the room, there are state experts, they got lots of things going on. This is our State Medical Operations Center, doing similar kinds of things, but for our function, we have federal partners in the room. A lot of them we worked with many times before. This is the last one, the last slide, and it ties into your question, which was, so I was talking about vector control, and part of the slides in here was to kind of just show the size and scope of all of this, is we're doing aerial spraying right now of mosquitoes across the entire Gulf Coast, from Corpus Christi over to Beaumont and inland quite a ways, because what we heard from the local level is we can't get out and do the work to recover because of the mosquitoes, and so ground-based spraying doesn't really put a dent in anything when you go to do this kind of size. And so we've got Department of Defense is in flying C-130s and spraying over large amounts of area. We've got a couple of contractors that are doing that as well, and that's really intended to help recovery, so you can get in and start assessing and doing the things we need to do, but also to protect against those vector-borne diseases. About 3 million acres sprayed so far, and be 5 million by the time we're done. So really big effort. So in that same area, people have to go out and check the water. People have to go out and look at retail foods. A lot of places closed, they need to reopen. So what do they need to do to make sure food is safe? We don't need a foodborne outbreak. Water, all of those kinds of things are considerations when you start looking at the recovery efforts, as well as infrastructure. And that's healthcare infrastructure, but it's also infrastructure like education and other issues like that.
So, the public health issue is really paramount on this, and the mosquito vector problem. This is an area that's prone to mosquitoes anyway. But one of the big partners we got there is a United States Air Force, I think it's a National Guard unit that has 3 C-130s that are specifically outfitted for airborne spraying. Everyone in the crew has to be certified in pesticide, so they have to have that certification. So we can't just flip new pilots into that aircraft and fly it. They fly at night, they fly at 500 feet, and they only fly where they're permitted to fly. So we have areas that are off limits. There's certain federal reserves and state parks, and other areas. And if the county judge, and there is one county judge, says, don't fly those things over my county. Now, I won't name that county's name, but you might want to have a conversation with your county judge and ask him, why wouldn't you have those flights coming over? Now, we're in a race with time. So the question was, well, why didn't we deploy those to like the Jack Brooks Airport and then on to Ellington Field, moving from east to west? They put them at Kelly, and the reason is because they have 80 personnel to run that unit, and they didn't have anywhere to stay. And the second reason is, as you know, Kelly Air Force Base is where all of the mechanics are. So one of them went down temporarily, another one went down temporarily. They're all three flying every night, and we're in a race against time to get them completely covering the grid, because guess what? They're going to Florida because the Floridians have Irma, and they're going to want the same coverage. So they fly on a computerized directive, and you've got to take into the wind speed on the ground at 500 feet. That's not a far way for the droplets to fall, but they go slowly. And if you got a 10 knot crosswind, you know, you've got to fly upwind to be able to drop it on the target. And it's a very complex ballet in the middle of the night. So if you live in that area and you hear low-flying aircraft, it's the United States Air Force, and they're here to help you. The other part that, and Kirk didn't mention this, is that we believe that there will be a need for a second spraying because of the larvae life cycle. We got larvae in the water. We think we're going to have to bring them back at the end of the month or the 1st of October. The state has put on a second contract for some other areas that are a little smaller down the coastal bend. So the Air Force isn't going to do it all, but the state is pitching in, and the federal government. And this is, again, that partnership. Where do you got it? Where's your zone? Where are you working? And where are we working? And why are we're talking together, we're working together, and that's how we're going to get this thing solved.
Well, thank you. We're just about out of time. I think you've got a minute, the two of you, to, what lessons have we learned from Hurricane Harvey compared to Ike or Rita? Quickly.
I think we reinforced the things that we knew, and the reason we were able to respond well is because of those previous experiences. That's where we learn the lessons, we apply those lessons, we make everything work better. I think we have definitely a few areas we can improve on, and we'll definitely work through that, talk through those kind of issues, and continue to improve.
So I would only say three things. The tip of the spear for HHS is Commander Betty Hastings. She's very experienced. She is permanently in Texas until she's redeployed. She was here for the floods as the HHS partner in 2015. She dealt with the Louisiana floods in 2016. She was called off that 2.5 weeks ago. We've had her on the ground. She's out there forming a team up to partner with Kirk and his colleagues in the state government. The other is Mike Burns. Mike Burns is a federal disaster recovery coordinator, and I had a chance to meet him this Monday at the all-call meeting where they brought all the federal agencies in together. Mike Burns was a firefighter in 9/11. Mike Burns has been in disasters personally. Mike Burns led the entire coordination and the federal response to Hurricane Sandy. So he's been there, done that. He got pulled off of a very high-level project, and I have high levels of confidence in him. And then the last is a post from a lady that I know in Beaumont who put it on Facebook. She said, "Let this be a lesson to all you wives to say yes when your husband wants a high-profile pickup and a flat-bottom boat."
Gentlemen, thank you very much.